Good morning, my dear brothers and sisters. First of all, I would like to welcome you all to this workshop. Uh, Before we continue to the next slide, I think it is a must that we introduce ourselves. So I would let my team members to start off first, and then I'll go last. My turn. My name is Merika Kanangak. Uh, I work as I work in at the hospital as a health educator. The topic that you can see on the whiteboard there is maternal health complications in Kiribati or maternal health issues in Kiribati. The target audiences are pregnant women, parents, and spouses. Right now, uh, I guess you get the idea why you guys are invited to this workshop. Next slide. Maternal health introduction. Maternal health refers to the health of women during pregnancy, childbirth, and postnatal uh, period. So there are three stages there: uh, uh, during pregnancy, childbirth, and postnatal period. Each stage should be a positive experience, ensuring women and their babies reach their full potential of health and well-being. So the three stages mentioned there should be a positive experience to the women and the baby. So that's basically all about maternal health. Or so there and on that slide is only a photo, and it's a photo of a woman, pregnant woman, and a doctor. That's basically maternal health. Kiribati data. Okay, Kiribati data. Unfortunately, we have lost three women. Very sad. The cause of death there is first one shock during or following labor and delivery. Shock often caused by uh, the loss of blood, much blood lost. Second one is unspecified maternal hypertension, that refers to the high blood pressure. That's it's very important also for a pregnant woman to always check a blood pressure. The third one is malignant neoplasm of bronchus and lung. Basically, a cancer that affects the bronchus and the lung. This is cancer that often grows from a very small to 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 a big one, uh, and it needs to be treated when it's when it's uh, when it's a small cancer, because sometimes it can be grow slowly, sometimes it can grow rapidly. That's why it has to be treated right away. Courses, maternal health courses. We have discussed three of them, but basically they were related to some of the courses here in this slide. Severe bleeding that basically can cause shock, as we discussed before, and mostly bleeding after childbirth. Infection usually after childbirth, high blood pressure during pregnancy, pre-eclampsia and eclampsia. Okay, this is a rare case. Sometimes it is really rare to happen, but it can be happening as well, and it's a RAMS eclampsia. It's a brain disorder that happened because of the cause of high blood pressure. Okay, complications from delivery, and the last one is an unsafe abortion. That's how the process. Maternal health treatments. This is one of the slides that we have to focus on because that's how we treat the problem. The first one is keep your prenatal appointment. Okay, so you have to keep it. If it says if your doctor says come and check right now, you go. Don't uh, procrastinate. Visit your health care provider regularly throughout your pregnancy. That is all about keep your prenatal appointments. Take your blood pressure and medication as prescribed. Your healthcare provider will prescribe the safest medication at the most appropriate dose. Stay active, straightforward. Eat healthy diet. Know what's off limits. So that's the treatments. Maternal health prevention. These include a range of interventions such as antenatal care. Antenatal care is sometimes they call it pregnancy care or maternity care. It's all about uh, visiting your doctor or midwives and to inquire what are the important steps or ways to keep you healthy as a pregnant woman. The other one you're training, traditional birth attendants. This one is it's for the attendant, birth attendants, traditional training of traditional birth attendants, especially those it refers to people beside nurses and doctors. Provision of micronutrients, okay, taking vitamins and uh, balanced foods uh, to the pregnant woman, improving girls' education. So you have to educate your girls about maternal health and also to prevent maternal deaths and empowering of women. To avoid maternal deaths, it is also vital to prevent unwanted pregnancies. Unwanted pregnancies. I hope you will understand why we have unwanted pregnancies. Sometimes maybe because of alcohol, or maybe we just don't think. So it is very important that we control ourselves. All women, including adolescents, need access to contraception. Some beliefs maybe not taking this uh, as a as a as a top priority, but I guess to us we that we have no restriction on that. We can access to contraception, save abortion services to the full extent of the law, and quality post abortion care. Maternal health conclusion. Okay, to conclude, maternal health issue can be controlled. prevented and reduced. But it is up to the individual woman to take good care of herself, the medical service to educate, the parents to assist their daughters through their parental care, and of course the husband or boyfriend to look after your wife's own girlfriends. This is a very important uh, action, the action that we should be involved in, because maternal health always involves two people, the mother and her child. So we have to take this in consideration, and with a high priority, because we're saving lives when we do so. Okay, we're coming to the end. Thank you for your time, and now it's time to ask questions. Thank you very much.